So in 2007, some new guidelines came out for managing asthma. And the guidelines are just a roadmap for us to really think about our asthmatics and help guide our care. And the guidelines really focus on two things: impairment, which involves the intensity and frequency of these asthma symptoms, and the goals of therapy for that are to reduce their symptoms, reduce their need for these rescue medications, and allow them to have normal daily lives, and that's the goal. This is evaluated by the different symptom tools that we use. So when these patients are coming in, we're giving them the ACT test, and there's other validated tests that should be used each time our asthmatics come in to ask the patient and family questions about how their asthma is controlled so that can help us figure out how to manage their asthma. And then this domain of risk. And risk really is looking at adverse outcomes, including exacerbations, the need for oral steroids, loss of lung function due to frequent exacerbations, and the goals are to reduce all of those. Questions that we can ask to determine risk include: have you had urgent visits? Have you been to the ER? How much oral steroids have you needed? And are you exposed to cigarette smoking? Now, I'm not going to spend too much time on this, but this is just some components of the guidelines. When we see patients with asthma, when we're trying to figure out what their level of severity is, and the main thing is starting off with the rule of two. So intermittent asthma, the patients typically have symptoms less than 2 times a week, nocturnal symptoms 2 or less times a month, needing albuterol or a bronchodilator as a rescue 2 days per week, and they usually have preserved lung function. But as their symptoms become more frequent and there's more increasing lung function abnormalities, it's going to go up to more persistent forms. And the guidelines gave us this stepwise approach to have a framework of how we treat these patients. So for those that have very intermittent symptoms, the albuterol as needed. And as you move up, as the patients have increasing symptoms, you move up and step up therapy. A really important point of the guidelines is that we always want to constantly reassess our patients so that they can start stepping down therapy once we get good control. And what I want to talk about today is what happens when we start getting up to these higher levels, step 4 through 6, and our patients that we're seeing that have lots of asthma symptoms despite what we believe is good therapy. And that's when we start to think about some other therapies like anti-IgE or Xolair. And then we really need to start thinking about other factors that are influencing their asthma control.